As patients, carers, members of the Philippine Alliance of Patient Organizations, we breathe disease and death every day.
It is a struggle on all fronts, physically, mentally, emotionally, spiritually, and financially.
It has its disappointments, but also high points, as we encounter kind, healing souls along the way. But just when we thought we had it tough, COVID-19 made our fears bigger and deeper.
We cannot afford another disease, nor can we afford to put up a fight on all fronts. This is not our fear alone. Never in the history of mankind that there has been a disease that destroyed and disrupted so many lives and hope all over the world.
The COVID-19 vaccine is offering us hope. It is not perfect, but at this moment, it is our best chance to stop living in fear and to start living in hope.
This will not work if only a few of us chose to be vaccinated. All of us need to get the vaccine because no one is safe until everyone is safe.
PAPO stands solidly with experts and advocates for COVID-19 vaccine. We invite you to join this call of unity as we launch Bakuna Now Na to address the infodemic and help increase vaccines acceptance.
Never in our history has there been a more urgent call to stand united, get vaccinated, so together we can overcome COVID-19.
Bakuna, now na! Bakuna, now na!
Bakuna, now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna Now Na!
Bakuna! Now na!
Bakuna, now na!
When it comes to how many kids Filipino couples want to have and how many kids they end up having, meron tayong nakikitang pattern. Parents usually end up with one child more than what they initially wanted. At ang pinakamahihirap na pamilya, sumusobra pa sila ng dalawa. Pag mas malaki ang pamilya, mas lumalaki rin ang posibilidad na maging mahirap ang pamilya. Poverty leads to children growing up not reaching their full growth and productivity potential. Responsible parenthood and family planning is one of the 3 program components of the Philippine Population Management Program. Tugon ito sa pangangailangan para sa epektibong pagpaplano ng pamilya. RPFP has 3 goals: 0 unmet need for modern family planning, pataasin ang paggamit ng modern contraceptives to 65%, at maiwasan ang di inaasahang pagbubuntis, lalong-lalo na para sa mga mahihirap na kababaihan. Sa RPFP, matutulungan ang mga couples na ma-achieve ang tamang pag-aagot ng pagbubuntis at ang bilang ng gusto nilang maging anak na kayang bigyan ng maayos na tahanan at kinabukasan. May iigtingin ng kampanya para maipatupad ang Responsible Parenthood and Reproductive Health Law at Executive Order No. 12 sa mga lokal na pamahalaan. We'll use communication campaigns to promote responsible parenthood and family planning, natural man o artificial methods upang tumaas ang demand para rito, especially among poor women and families. Ilalapit natin ang reproductive health services at contraceptive commodities sa mga mahihirap na komunidad para ma-access ng sino mang gustong magplano ng pamilya ang family planning method na hiyang sa kanila. With the Responsible Parenthood and Family Planning Program of the Philippine Population Management Program, we'll make sure that couples and individuals have the knowledge and support they need to start the family of their dreams. Empowering Filipino families.
Labanan ng COVID-19, ang kailangan natin ay tama at totoong impormasyon, hindi fake news. Huwag kaagad maniniwala sa nababasa at naririnig. Ang pagkalat ng mga maling paniniwala tungkol sa COVID-19 ay nagdudulot ng panik, takot at maling desisyon. Laging i-double check kung saan nanggaling ang nabasa o narinig. Maging mapanuri at i-share lamang ang tamang impormasyon. Sa wastong pag-iingat, ang virus hindi kakalat. COVID-19, kayang-kaya nating tapusin.
Patuloy pa rin ang laban natin sa COVID-19. And together, we can beat the solusyon.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
C. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
B-I-D-A. Be the solution sa COVID-19.
Magandang gabi po sa inyong lahat. Ito po muli ang Alaga Health Live. I'm Doc Dexter Galban. At ngayong gabi, napakaganda ng ating pag-uusapan dahil ito ay tungkol sa ating vision, sa ating sense of sight. At of course, hindi makukumpit ang ating Alaga Health Live kapag hindi natin kasama ang ating mga medical experts. At umpisahan na natin sa ating resident celebrity psychiatrist, none other than the wonderful and amazing Doc Joan Perez-Rifareal. Good evening, Doc Joan. Welcome po to Alaga Health Live once again. Magandang gabi po, Doc Joan.
Hello. Good evening, Dr. Dex. And of course, to everyone na nanonood. Good evening, good morning, good afternoon. O, kasi diba, anytime nila pwedeng mapanood. So, good day to everyone. Thank you, Dr. Dex, for having me once again.
Thank you very much, Doc Joan. And of course, joining her, ang ating Alaga Health resident primary care physician, none other than the lovely, the beautiful Doc Jucille Roderos.
Hi, good evening po. Doc Joan, good evening. Doc
Hello!
Dex, good evening
Hello,
also.
Bia!
Yes
Kamusta?
po, no? By the way, mga viewers, no, abangan po natin si Doc Joan. She will have her spin-off show very, very soon, no? We will be announcing that later on po. But, no, before anything else po, nako, very interesting ngayon yung topic natin kasi it's about, yung ating mata, no? Paano ba natin pangangalagaan ang ating mga mata? This is very close to home because, for the longest time, I wanted to wear glasses. But now, since I'm wearing glasses, medyo ayoko na, no? So, sa mga viewers natin na may problema po sa kanilang paningin o sa kanilang mata, comment away, no? We will be reading and answering your questions, no? For all your concerns regarding mata po. Pero if you have any questions regarding your health po, and of course, regarding your mental well-being, nandyan po kami ni Doc Joan and of course, our special guest to answer your concerns.
Yon, thank you very much for that, Doc V. No? And tama-tama ka dyan. Please po, no, sa ating mga viewers ngayong gabi, please feel free to tell us your questions so that we can answer them here ng live. At of course, kasi napag-usapan na natin ang mental health, nandyan ang ating primary care. Nako, yung ating topic today ay tungkol sa Sight-Saving Month ngayong buwan ng Agosto. And of course, back by popular demand. At mukhang dahil excited din sila dun sa potential na spin-off cooking show, nagbabalik muli dito sa Alaga Health Live ang nag-iisang chef/doctor, none other than Doc Mara Augustine Galang. Good evening, Doc Mara.
Hello, Dex. Hello, Doc John, Doc Bia. Good evening. Thank you again for having me.
Love it. Thank you very much for joining us again, Doc Mara. Talagang tuwang-tuwa sila dun sa iyong episode tungkol sa ating nutrition. No? So once again, at since it's Sight-Saving Month, maganda siguro pag-usapan naman natin ang tungkol sa mata. And to kick things off, perhaps it's time for our Alaga Health Check-up. Yan, to kick things off, tanungin siguro natin si Doc Mara, no? Doc Mara, ano pa nga ba ang value at bakit nga ba natin sinaselebrate ang Sight-Saving Month, no? Napaalala mo yan sa amin nung ating isang episode before, nung Nutrition Month celebration tayo na August is also Sight-Saving Month. Tell us more. Ano nga ba yung value nito at ano yung mga pwede nating i-expect this month of August?
All right. So, well, ophthalmologists in the entire country are celebrating the Sight-Saving Month this August. And siguro we cannot just put much emphasis enough no kung bakit importante to take care of our eye health, our sight health. Kasi, like, for me, for a beginning ophthalmologist, madami kasi kaming nakikitang patients wherein they already have severe visual loss or visual impairments, which are actually stemming out from a systemic condition. So, hindi nila na-realize early on na itong mga systemic diseases pala could actually affect their vision. And the only time that they come into our clinic is kapag malala na yung condition nila. Malala in a sense na affected na ang kanilang activities for daily living, o kaya they will really need assistance from their family members, o kaya impaired na rin yung kanilang ability to work and perform efficiently and confidently. So I guess siguro baka medyo na kakalimutan lang ng iba sa atin na eye health is just as important as the health of any of our body parts. So again, yun lang. Sana ngayong August, we put attention and value to our eyesight.
Perfect. Thank you for that, Doc Maran. So at least lahat ng viewers natin ngayon alam na yung value ng ating pagpapacheck up sa ating mata. And of course, let's kick things off with the questions from our viewers. Ito yung mga questions and comments na nakuha natin from our local PubMats and even the Alaga Health inbox. And we're very, very excited because unang buena mano pa lang, no, napapansin ko may mga familiar names ang ating mga viewers na lagi-lagi nanonood ng Alaga Health Live. Special shout-out sa Chow family na sila ang nagbigay ng ating very first question. From Ma'am Suan Chow, no, I believe yung kapatid ni Ma'am or yung father ni Ma'am ay naging live na kasama natin dito sa Alaga Health Live before. So ang tanong niya, ano nga po ba yung macular edema? Nako, one of the questions na laging hina-highlight, no? So, Doc Mara, ano nga po ba yung macular edema? Yun yung kauna-unahang question na lumabas nung pinalabas natin yung ating PubMat on this particular Alaga Health episode. So, Doc Mara.
Yes. Okay, so macular edema, or madalas kasi associated siya with diabetes, no? So we call it diabetic macular edema. So what actually happens is, sige, mag-step back muna tayo to diabetic retinopathy per se. So in diabetic retinopathy, what happens is you have vascular derangements. Just like how it affects yung other microvasculature sa katawan natin. Like, di ba, you have your diabetic kidney diseases. So, ganun din for the eye. So, the microvasculature, yun yung greatly affected by this disease. So para sa opta-wise, so what happens is you have pericyte losses, basement membrane thickening, and the loss of endothelial barrier function. So medyo jargon man siya, but that's how we can explain to them na nagkakaroon ng tagas, no? When we say there's loss of endothelial barrier function, so diba barrier, so para siyang tight junction, and then so when we lose this function, nagkakaroon ng leak ng serum to the retinal space, basically, which causes retinal edema. So, and it just so happens that it can occur near the macula, near or around the macula, which is the center of our vision. So, kung may pamamaga doon sa sentro ng paningin mo, definitely you will have visual impairments, no? So sila yung mga patients natin who will really have poor visual acuity and will really come to the clinic saying na hindi na nila maaninag yung mga tao or the things sa paligid nila. Basically because yung sentro ng paningin nila yung may pamamaga. No, so we can diagnose this only after we see the patients in the clinic and evaluate them further to know how we can manage these patients. Kung kaya ba siyang i-manage pharmacologically, which is the first line, or surgically, like in the form of laser. So yun.
Ayun, thank you very much for that, Doc Mara, no? And I hope na nakikinig po si Ma'am Suan, no? Sige, talon tayo sa next question natin dito, no? And ito galing sa Alaga Health Inbox. At nanggaling siya kay Sir Reynaldo de Asis, no? Alaga Health Inbox, question number 1. Tuwing umiinom ako ng gamot na pampakalma, parang lumalabo ang mata ko. Pwede bang palitan na lang? Ay nako, alam ko kung kanina mapupunta tong question na to. I think this will go to Doc Joan, pampakalma. Yes. So, banggit, Doc, kung ano yung mismong gamot na iniinom niya, pero apparently, parang pag iniinom niya, lumalabo yung mata niya, pwede na lang ba daw niyang palitan o baka itigil niya yung pag-inom? Anong ma-advise niyo sa kanya, Doc Joan?
Yeah, good evening. Sino ba yun? Dr. Dex? Good evening po sa nagpadala ng question. Yes, bawal. Wag po muna, no? It's talagang advisable. Wag po kaagad na itigil po. Mas maganda kasi ang mga medications po kasi na ginagamit na pampakalma, no? We are not sure kasi kung anong name or anong type of medication yon. But potentially kasi almost all ng mga psychotropic medications na ginagamit pampakalma or pwedeng pampatulog, may mga side effects sila to some. Hindi naman sa lahat. Depende rin sa reaction sa body. So, what's important is number 1, talk to your doctor. Makipag-usap sa doctor about it para alam ng doctor na it's causing side effect na itong sa vision. Kasi baka mag-request ang doctor ng eye exam para to rule out yung mga any other causes ng blurred vision. At number 2, titingnan kung ano ba ang, kasi may marami din potential kasi na reasons for that. So baka side effect siya na yung tinatawag natin na yung because of the muscles ng eye, so parang tumitingin sa taas. Hindi natin kasi alam kung ano yung medication na tinutukoy, kaya meron din tinatawag na gano'n, yung lagi nakatingin sa taas. No? So merong binibigay na pang-reverse ng side effect na yon. Or another option is baka bababaan ng doctor yung dosage, pero hindi pwede tayo-tayo lang i-stop natin siya kaagad kasi baka merong mga ano din po, mga negative side effects sa ating katawan kung bigla natin siyang tatanggalin or ititigil. So, mas maganda talk to the doctor po na nag-prescribe ng medication.
Yun. So, sir, advice po ni Doc Joan, huwag po
Yes.
basta tigil yung pag-inom ng gamot dahil, nako, meron po tayo mga kondisyon na hopefully mas napapagaan ang pakiramdam o kaya naman ay nare-resolba nang dahil sa pag-inom nyo ng gamot. So siguro i-adjust lang natin or masabi natin dun sa doktor kung ano yung nararamdaman. Baka ma-tweak natin ng konti, no? So, thank you very much for that, Doc, no? Tanong lang tayo sa next question. Ito ay comment, no? From Ma'am Mary Bayas-Bas, Kahusay. Ako ay may katarata. Di ako makapagpagamot. Ano kaya ang pwede kong gawin? 71 years old na ako. Nako, cataracts. Quote-unquote, ang pinaka-favorite at and/or common na nakikitang kaso ng ating mga ophthalmologists. Kumbaga, ito ang kanilang mga go-to cases kasi napakaraming kaso na inooperahan tungkol sa cataracts. And siguro pwede tayo mag-tandem response dito, no? Una, yung kay Doc Mara tungkol sa paano natin siya pwedeng resolbahin. At kay Doc Via, ano nga ba yung pwede nating gawin in terms of probably prevention or management doon sa kaso na to? So, let's start with Doc Mara.
Alright. So, for Ma'am Mary Bayas-Bas, no, so given na 71 years old na siya, we can actually deduce na probably this is cataract senile, no, because of her age. And then, for their information, no, for cataract po kasi, ang ating solution for this is really surgery. Okay, so you have to remove the cataractus lens material via surgery. So wala tayong like medications or eye drops that will resolve. There are a few medications in the market who market themselves as parang anti-cataract daw, but these are just addressing one of two of the things that will cause cataract but not the entirety of it. So eventually magkakaroon at magde-develop pa rin yung cataract. If these medications help, probably it will just slow down at a very little rate. But eventually, the cataract will still progress. Now, for our patient here, so kung hindi siya makapagpagamot sa ngayon, it's hard to say kasi na, sige, hayaan, of course not, hindi natin gagawin yon. Ideal talaga is for them to consult their eye doctor to evaluate kung gano'n na ba kakapal yung katarata and if she can be accommodated for an immediate surgery. And other than that, kasi pag mga patients natin na may cataract, we don't just remove the cataract per se, no? For our complete ophthalmologic evaluation, we also check other parts of the eye, like yung sinasabi namin palagi na titingnan din natin yung likurang bahagi ng mata. Say for example, their retina, kasi kung meron silang comorbidity, say hypertension or diabetes, which can affect the retina. So baka meron din silang underlying problem, which is actually adding up to the problems ng blurring of vision na hindi lang nanggagaling sa cataract per se. So you know, para mas thorough talaga yung approach dun sa complaint ng patient na hindi na siya makakita, yung hirap ng makakilos on a daily basis, it will really be best na they will be seen by your eye doctor, no, for a thorough ophthalmologic examination.
Naku, Doc Dex, baka naka-ano ka ata, naka-mute ka ata, Doc, no? Pero tama yung sinabi ni Doc Mara, actually. Yeah, oo.
Yes. Ang ganda na nabanggit ni Doc Mara, di ba, Doc V? Kasi na-highlight niya na yung mga nakikita nating concern sa mata, pwede daw kasing tungkol sa hypertension, tungkol sa diabetes, tungkol sa napakaraming bagay. So, when it comes to that, siguro Doc V, pwede sila magbigay ng advice, magbigay mo sila ng advice in terms of preventing natin yung mga pagkakaroon ng ganitong mga conditions. Ano ba yung mga pwede nilang gawin na siguro, kasi siguradong natakot sila nung sinabi ni Doc, parang ang gamot po dyan ay surgery. Nako, nag-alarm sila kaagad lahat. So ano kayang pwede natin gawin para ma-encourage natin sila to better take care of themselves para hindi sila mabot sa point na kailangan na ng surgery?
Doon muna tayo no, sa point ni Doc Mara regarding dun sa cataract before yung prevention natin. Kasi tama sinabi mo, Doc Dex, na kahit na yung nararamdaman natin ay hindi related sa mata, no, meron pa ring komplikasyon no, na maaaring madudulot nito sa ating mata. Pero I'll go back to that later. Yung sa senile cataract, no, usually po, pag sinasabi nating senile cataract, lahat po tayo eventually, no, maaaring magkaroon ng ganyan. So, it's something, no, na minsan, when I was little actually, sinabi ng may mga lolas tayo na ayaw magpa-opera kasi nga natatakot, no? Pero later, Doc Mara can probably explain how quick, no, paano nangyayari po ba yung cataract surgery para at least, no, malaman nila kung paano po, gaano po kabilis, no, yung surgery itself, no? Doc Mara, minsan before nung nag-a-assist kami for ophtha, it just takes ilang minutes lang, Doc Mara.
That is true. The fastest I've seen was around 9 minutes lang. Like, sobrang bilis.
Baka pag ikaw, Doc Mara, mas mabilis.
Oy, mangangarap tayo na ma-achieve yun.
Nagpapaimpake na si Doc kasi natapos niya kaagad. Doc, seryoso? Hindi pa tayo nagpe-prepare pa lang? Tapos na talaga tayo? Ganun lang po talaga kabilis yung pag-opera ng cataract, especially kapag sanay na talaga. Tapos, kumbaga hindi siya masyadong matigas, quote-unquote. So, yun, some considerations for our surgery. Kaya huwag po masyadong maging concerned.
Oo.
So,
pero in terms of, Doc Dex, pero in terms of prevention, no, eventually lahat tayo ay tatanda, lahat tayo magkakaroon ng cataract, no? Buti na lang yung mga doktor natin dito, si Doc Mara at si Doc Joan, medyo fresh pa sila, no? So matagal pa yan. Matagal pa tayo magkakaroon ng cataract. But in terms of caring for your eyes po, especially dun sa health natin, no? Some systemic conditions such as diabetes and hypertension, magkakaroon po yan ng mga komplikasyon at kasama na dun yung sa mata natin, no? Diabetic retinopathy, no? Minsan, for example, kasi kung we have hypertension, no, usually our vessels, yung mga ugat po natin, may mga bara po yan. Pwede po yung mga bara natin maka-apekto din dun sa mga natin, sa mga ugat-ugat sa mata. No? So, it's very important for us to still, no, care for our health and well-being, no, especially dun sa mga pagkain po natin, kailangan po nating bantayan, no, yung low salt, no, low fat, low cholesterol na intake po. Tsaka po yung low carbohydrate po. Huwag po nating masyadong damihan po yung rice natin, no? And of course, to those who have been taking maintenance medications para sa high blood nila tsaka sa diabetes, huwag po nating ihinto unless po na thoroughly check po kayo ng ating mga doktor. Kasi po pag stinop natin yung pagtitake ng medication natin, kunyari nakita natin yung BP natin mababa na at stinop natin yung medication natin without consulting your doctor, maaari po na mahulog yun sa maraming komplikasyon, no? Or kunyari nakita mo, nagpa-laboratory ka, nakita mo mababa yung sugar mo, stinop mo yung yung metformin mo kasi that's usually the maintenance ng mga mga may diabetes. Maari po na maapektuhan yung iba't ibang organ system natin, kabilang na rin po doon yung mata natin. No? So pangalagaan pa rin natin yung ating kalusugan, no? Kasi ito ay konektado, no? Lahat-lahat yan konektado, no? Sabi nga ni palagi sinasabi ni Doc Joan, lahat po yan magkaka-connect po. So take care of your health po because it will have a lot of effects, not only to the system that involves the disease, but also to our other systems as well.
Yon, thank you very much for that, Doc V. And before we move on to the next question, just a quick shout out to all of our viewers watching now, the Chao family, Gahudo family, the Rosales family, Rojas family, Ramilo family, and the Maloles family, no? Ang ganda ng mga tanong nila kasi may mga pahabol pa dito actually, no? Kasi nabanggit natin, Doc Mara, yung tungkol dun sa surgery. Pahabol na tanong ni Ma'am Suan siya, nako regular viewer siya dito sa Alaga Healthline. Paano ba malalaman pag quote-unquote hinog na ang cataract, no? Pipitasin ba natin yun? Ano bang gagawin natin? Very briefly lang siguro, Doc Mara.
Okay. So, before kasi parang or kunwari kung nagpa-consulta na sila prior sa ophthalmologist and then they take a quick look sa mata and then sasabihin na hindi pa hinog yung katarata. So, probably balik sila after 3 months or 6 months. Tapos tignan kung hinog na, then that's the time that we plan for the surgery. But that is actually medyo kasi na, no? Kasi ngayon, whenever we attend to our patients, ang basis ng kung kailan, like when to do the surgery, is actually individualized, no? Depende sa visual needs ng patient. So kung kunwari, si 20/60 pa yung vision niya or 20/40 for example, which can be good for some other people, pero for this particular patient, say visually debilitating na yun for him or her, no, pwede nating sabihin yun na he or she is a candidate na for the surgery. He or she can have na the surgery. So, pag sinabi kasi natin na yung hinog na yung katarata, so yun sila talaga yung mga puting-puti na talaga na grossly. Kita mo na may puti right in the middle of the eye. So, that is the cataractus lens na mature na talaga or hyper mature even. But just to clarify, no, hindi natin kailangang paabutin na sobrang puti na niya para lang tsaka ka pa lang magko-consult to your eye doctor and then have it removed. No. When to do the answer to when to do the surgery is always individualized, no, depending on the visual needs of the patient. No, so like kung may dadating na patient, kung pwede pa siyang i-refract, and then he or she is still comfortable with those prescription glasses, he or she can still continue with activities of daily living ng comfortable, ng hindi siya, hindi niya feeling na impaired siya visually, then okay, he can still live with that. But if if there's really difficulty na in moving around and doing their work, then we might as well have the surgery done. Diba? Kasi in the long run, kahit magsalamin tayo ng magsalamin, but the refraction will eventually change. So, magiging costly pa yun sa end ng patient. Palit ka ng palit ng glasses, tapos hindi naman naakma yung refraction. So, cost-wise, baka mas madali pa to have the surgery done na lang immediately. And, generally, quality of life yung nasasagot natin, not just the visual impairment, diba?
Absolutely agree with that, Doc Mara, no? So, maganda siguro na talaga i-consulta natin yan sa doktor. And ito, bago tayo pumunta dun sa ating quick segment break, no? Sagutin natin yung isa sa mga pinaka-common na tanong siguro ng mga taong medyo lonely ngayong pandemic, no? Lalo na mas malalayo sa pamilya, etc. Yung iba, especially yung mga kabataan ngayon, as part of coping with the loss of face-to-face interaction, loss of access to yung usual natin mga activities na ginagawa. Ang ginawa nila ngayon, lahat nasa computer ngayon. In short, quoting lahat ng nanay ng bawat Pilipinong kabataan ngayon, kaka-computer yan.
Kaka-cellphone mo yan.
Ang tagal nilang nakatutok sa kahit anong screen, cellphone, laptop, etc. And yung iba, this is part of the coping mechanism dahil sila nga ay nakakaranas ng possible anxiety, depression, or other mental health-related concerns. And pwede ba, Doc Mara, and siguro Doc Joan, ano kaya yung pwedeng maging impact nitong shift na to? No? We have nakita na natin yung Zoom fatigue, nakita na natin siguro yung issues na overexposure sa mga screens. So mukhang mental health and screen-related problem to, and even on ophtha problem. So, any quick comment siguro from Doc Joan and Doc Mara? Combo magic yan ng ophtha and mental health. So, siguro we can start with Doc Joan.
Yes, oo. Agree ako, Dr. Dex. No? Talagang ngayon, we are madalas. In fact, lahat studies have shown na talagang tumaas ang ating gamit ng mga gadgets during this time of quarantine, pandemic. Tumaas talaga siya. And ang mga studies also would show na may mga effect din to, impact on our eyesight, di ba, Doc Mara? Like digital eye strain is one, which wherein kung sobrang haba ng ating pagkatulog sa ating mga screens ng gadgets, nagkakaroon ng digital eye strain. I think si Dr. Mara mas better to explain kung ano yung mga simptomas nun. And of course po, yung na-mention mo kayo na Dr. Dex, no? It's a real phenomenon ngayon. Virtual meeting na mga fatigue because of back-to-back ng mga meetings online kahit na mapa-work from home or ang mga bata, no? Kung online classes or distance learning. So talagang these can have an impact on our mental health kasi kasama na doon. For example, yung may mga studies also which showed that during this time of pandemic, the more time spent on our gadgets, yung pagbabasa ng mga social media, kasi usually doon tayo kumukuha ng mga news or updates, meron din siyang impact on our kalusugang pangkaisipan, no? In the form of symptoms ng anxiety, iba talaga nakakakaba, no? Yung mga nababasa natin, or symptoms of stress, distress, or depression. So that's why it's really important, ang always nire-remind ko is to find the balance always. Of course, kung may magagawa tayo, i-lessen natin ang ating gadget use to prevent or lessen yung possibility of developing yung digital eye strain at take breaks. If kailangan talagang gumamit ng mga gadgets, to take breaks. It's recommended, di ba, Dr. Mara, no, ng society ata ninyo to take breaks every 20 minutes to look into something, an object 20 feet away. No? So para lang ma-relax ang ating mga eye muscles also. And of course, yung the glare, di ba, Doc Mara? So talagang, again, as mentioned ni Dr. Via kanina, ang mental health talaga, it's present in everything. Kahit sa eyes, no? Even yung mga nagkakaproblema sa eyesight, it can also have an impact doon sa how they, how they cope with it. It can also make them feel anxious. Yung what was mentioned kanina, no? Sometimes nakaka-affect din sa mga iniisip nila kung kailangan bang itigil ang gamot or kailangan bang may gagawin na other options para bigyan ng lunas po yung mga nararamdaman concerning the eyes or eyesight.
Perfect. Thank you for that, Doc Joan. No? So, anything briefly to add, Doc Mara?
Yes, I completely agree with Doc Joan, no? So tama siya doon. There's this thing that we call digital eye strain. Kasi syempre mas napapansin yun ng mga tao ngayon kasi 'di ba work from home, online schooling. So hindi talaga may iwasan yung exposure to our gadgets and devices. So gaya ng sinabi ni Ma'am, no, there is this thing we call 20-20-20 rule, wherein after 20 minutes of using your device, you look 20 feet away, okay, para maipahinga mo yung mata mo for 20 seconds. So, 20 minutes of usage, look 20 feet away, and blink for 20 seconds. So, in that way, maipapahinga mo yung mata mo briefly before you return to the usage of your gadgets. And also, kasi hindi natin na-notice, the reason why we have those symptoms na parang frequent tearing or lumalabo yung mata is because when we are on our gadgets, nagde-decrease yung blink rate natin. So normally, we blink 15 times per minute. Pero whenever we are engrossed sa gadgets natin, nagde-decrease lang siya ng up to 3 or 5 per minute. So, yung mata natin kailangan na adequately lubricated siya na na-achieve natin with frequent blinking. So, yun yung reason kung bakit why we need to practice the 20-20-20 rule. No? So, and then, even so, kung kunwari, even with that practice, pero may persistence pa rin ng symptoms, then maybe you can visit your eye doctor who can prescribe you with lubricant eye drops to aid in keeping your eyes moisture, no?
Yeah, thank you very much for that, Doc Mara. Also, quick shoutout lang ulit tayo sa Villegas family, Magramo family. Special shoutout, congratulations daw, Dr. Joan. Marami kong fans dito si Doc Joan, especially our regular viewers here. And special shoutout din daw kay Dr. Via Roderos from Miss Emery Pasqua. Yan. So, I think our viewers are enjoying the discussions here tonight. We're very, very happy. But before we move on, let's have a very, very short Alaga Health update. So we'll be showing you again very briefly how easy it is to sign up for Alaga Health, no? And very important though, because Alaga Health app is already live and you can actually download it already. So first, you can actually go here sa ating alagahealth.com website, yung alagahealth.com. And then you can actually view yung content ng ating website, no? Our different partners, as well as some of the services that we provide, even the reasons why we even started Alaga Health. And look at all of the linkages that we have, as well as our advocacy partners. Medyo madami po, no? But ito po yung papakita natin sa inyong pinaka-importante, especially pagpunta nyo dito sa page. All you need to do is go here. Click the one at the top right, no? Top right corner, yung sign up. Dadalhin po nila kayo o dadalhin po kayo ng website sa ating registration page at sobrang bilis lang po talaga na mag-register for Alaga Health, no? So, dating kayo sa page na to, malalaman kung kayo ay pasyente, partner, or you're a health professional, health worker, or if you own a clinic or you have a lot of businesses related to health, pwede din dito sa admin app. So, for example, sa viewers natin ngayon, dito tayo sa patient app. So, click nyo lang po yung patient app, then press continue. And then, of course, basahin po natin yung data privacy. Very, very important po yan. Very compliant po ang Alaga Health when it comes to data privacy. Okay? So, just press continue. Don't forget to ensure that it's checked. And then, continue. And just like that po, no, you'll be brought to this page and you can already see yung profile details. Nilagay nyo na po yung name, last name, date of birth, gender, mobile number. And of course, don't forget to put a very, very secure password. No? Meron kaya tayo mga special password instructions for that. And after pressing continue, poof! Okay na po yung inyong registration for Alaga. And that's not going to take 2-3 minutes. That easy to sign up for Alaga. And same goes for our health professionals, no, who want to join the Alaga Health family, yet keep the branding of your clinic and keep your name very much available for everyone to book as well. So ganun lang po kabilis na mag-register for Alaga Health. And that's all for our Alaga Health update. So, balik tayo sa mga questions, no? Very interesting. We're seeing some questions talaga from our audience. Particularly ito. Question number 3. Alaga Health comment number 3. From Sir Noy Mangalino. Yan. Meron po ba sa mata, medyo malabo, kaliwa ko, madami na ako nagamit na eye drop. Sabi po, pasmado daw. Nako, parang familiar yan. Pag feeling daw nila lumalabo yung mata, ang dahilan, pasmado. Ano po ang comment natin dito, Doc Mara?
Okay. So, for this patient, no, baka kasi sir, hindi ko naman sinasabi na baka yun, pero ang suspect ko, sana hindi kayo nagsiself-medicate. Yun ang unang-una sa lahat, no? Kasi marami sa ating mga patients, bumibili lang ng mga over-the-counter na eye drops, no? So, nagsiself-medicate sila whenever they feel yung mga sensation ng eye dryness, yung mahapdi yung mata, o kaya palaging nagluluha, o kaya yung pakiramdam na parang may buhangin tuwing kumukurap. So, all of those are signs of dry eye, no? Kaya lang, hindi namin, ako personally, and even sa mga colleagues ko where I work, we do not prescribe yung mga store-bought na, yung mga over-the-counter na eye lubricants for several reasons, no? So that's why we really, really hope to see them first and then have your doctors prescribe a particular eye drop for them. Kasi baka mamaya, hindi lang naman pala to dry eye, it could be something else, no? So, yung mga store-bought kasi natin na lubricants, meron silang ingredients or preservatives that is not actually good for the eye surface. So, yun yung ina-avoid natin na ma-experience ng mga patients natin. That's why we don't advocate for them to self-medicate. So, again, always consult your friendly eye doctor for proper prescription ng inyong eye drops. Kahit na lubricant lang siya or artificial tears.
That's true, no? And very important yan, lalo na sa primary care. Pag hindi po kayo sigurado, tinanong niyo po yung inyong primary care, di ba, Dr. Via, no? Primary care doctors can also help assess you first before linking you to our specialists na opta, no? Kasi ngayon napakadali na pong bumili ng mga eye drops at kung ano po pong pwedeng ilagay sa katawan kasi lalo na kapag free shipping, nako, napakadaling makakadating sa bahay natin ng maraming bagay na pwedeng ipatak o inumin. So balik tayo sa question ng ating mga viewers. And again, special shout out to Huwat family and Sadaba family. So this one is coming from Ma'am Carmencita Baloloy. So minsan padilim-dilim yung mata ko pero bumabalik naman. Natatakot ako na mabulag na ako talaga. Wala naman kaming pampagamot. Sana po ay matulungan niyo kami. Nako, mukhang combination question to. Doc Via, Doc Mara, and Doc Joan. Kasi yung mga pasyente po natin, pag may nararamdaman, automatic kinakabahan na sila, na mabubulag sila, permanent incapacity, tapos this can have a strain sa mental health nila. Pero yung iba, of course, especially dun sa mga nahihirapan magkaroon ng access sa healthcare, ano kaya yung pwede nating may advice sa kanila? So, Doc Mara and Doc Joan. Siguro umpisahan natin kay Doc Joan kasi baka yung mental health related concerns nila can prevent them from seeking help, Doc. So, any advice po?
Yes, oo. Thank you for the question, Ma'am Carmencita. Of course po, wag mawala ng pag-asa always, no? Kasi parang ang ano dito is ang message is wala kaming pampagamot. Always po, wag mawala ng pag-asa. Help is always available po kahit naman sa mga LGU or kung saan po tayo makaka-consult, no? Meron always po. And again po, kung tayo ay nakakaranas during this time of pandemic, especially ng any form of anxiety, yung pangamba po, no? Anxiety in layman, pangamba, takot, or marami pong wino-worry, maraming pumapasok sa isip to the point sometimes hindi tayo nakakatulog. Ang isang presentation din po kasi yun is pwede din na somatic siya, physical symptoms like blurring of vision or parang nanlalabo or may mga nakikitang flashes of light. In fact, marami, it can present in maraming simptomas sa mata. But always po remember again na we can do something about it po. Like siguro, ang first step, kung wala po talagang mapuntahan na doctor is to make sure po to calm yourself. Na? So, in deep breathing exercises is very important po. Ito yung paghinga ng malalim, slowly through the nose, 4 counts, and then through the mouth out, palabas po ng lips, 4 counts also. No? So, slowly lang siya, ulit-ulitin po natin, Ma'am Carmencita, 10 times po. And always po, focus on your breathing. Remember po na meron po always pong help available for us. And maganda rin po also to ask na rin po ang ating doctor po sa mata, si Dr. Mara, kung ano po yung mga possible also po na causes for the blurring of vision. Aside po from the mga concerns natin po about the current pandemic na nakakaapekto sa ating kalusugang pangkaisipan.
Yon, perfect. Thank you for that, Doc Joan. Very quick response, Doc Mara, and even Doc Via, lalo na yung kinakabahan sila to seek consult o kaya naman hindi nila alam kung saan sila pupunta. Sige, Doc Mar.
Yes. So, kung halimbawa nagawa na natin lahat ng advice ni Doc Joan, but still there is the persistence nung pagdidilim ng vision nila, again, it will be best to really see your eye doctor kasi iba-iba kasi yung klase ng pandidilim, no? Maaari kasing baka central lang yung wala or generalized na madilim siya o kaya yung vision nila yung parang may kortinang nakaharang. So, lahat yun will mean different things. And iba-iba din yung management niya. Some of them more more immediate attention requiring than the other. So, isa-suggest talaga namin to really see your eye doctor for a thorough evaluation. Now, for Ma'am Carmencita Baloloy, kung walang pampagamot, wag po muna ng pag-asa dahil we have our government hospitals naman po who can accommodate you, especially kung ganitong kaso kasi it requires immediate attention, no? So, hindi naman po kayo itataboy ng ospital. Titignan po kayo kaagad. So, sana if you can find time and make time to see your eye doctor immediately, yun po ang pinakabuting magagawa po sa ngayon.
Yon. Tanong ko lang very quickly, Doc Mara, kaya niyo bang magkonsulta via telemedicine? Kasi yung iba natatakot daw pumunta ng ospital ngayon eh. So, posible na ba pag-opta telemedicine?
Yes, actually, we've started with telemedicine last year pa since that pandemic started, no? So, para ma-minimize din yung patients natin na pumupunta ng ospital, kung kaya naman silang i-manage via telemed, then we do that. So, pag nakakita naman namin na kailangan nilang mag face-to-face consult, so yun yung time na binibigyan namin sila ng scheduled appointment to the hospital para magawa natin yung complete eye exam. So, Ma'am Baloloy, mag-telemed consult po kayo, tapos sana mabigyan natin kayo ng schedule at makita po kaagad.
Naku, Doc Mara, maganda siguro na matry na nilang gamitin yung Alaga Health Platform kasi pati yung mismong telemedicine, pati yung pagsischedule na ng clinic visit sa inyo, pwede na natin yung coordinate, lalong-lalo na available na sa App Store and even sa Play Store ang Alaga Health app. So, but before we move on to our next question, ako, dumadami yung questions natin dito ngayong gabi, let's have a very quick segue and let's see what it's like to have Alagang Hello Doctor. Yan, this is Alagang Hello Doctor special segment of Alaga Health Live na nag-focus po sa mga shareable articles mula sa ating partner organization, partner enterprise, which is Hello Doctor, which is the Philippine chapter or the Philippine-based company ng international group na Hello Health Group. Yan. So, ito yung kanilang article for the week na nag-focus naman sa mga kababayan nating merong contact lenses. So, ano nga ba yung proper ways to properly use your contact lenses? Nako, na yun si Doc Mara. At for sure, she would love to share this also dun sa kanyang mga friends. At ang maganda po kasi sa Hello Doctor, and of course, one of the reasons kung bakit sila naging partner ng Alaga Health ay they share medically verified information. Not only na sinulat sila ng mga health professionals by Jan Alwin Batara, pero nireview pa siya ni Doc Victor Paulino, no, na ating ophthalmologist. So you can actually view the article here. Ito yung i-share niyo po sa ating mga social media platforms, pati na rin sa ating mga Viber groups. Nako, ang ating mga tita ay napaka-active sa Viber, sa Telegram, lahat po. No? So you can actually share this to them para alam nila how to better take care of their eyes, lalo na pag sila ay gumagamit ng contact lenses. Yan. So of course, apart from that, you can visit the hellodoctor.com.ph website to see other health-related articles. And we're very happy, no? This international group chose Alaga Health as its partner. And because we share that advocacy, we're very, very happy to help also champion ang pagkakalat ng proper and medically verified information to our kababayan. So with that being said, let's go back to our questions. Nako, ang dami nating questions ngayong gabi, nakaka-excite. So let's get back to the questions. Okay, meron tayong tanong dito from Ma'am Angela Reyes. I was recently diagnosed with bipolar disorder and I'm taking quetiapine. I always feel sleepy po. Is this normal? Can I take other drugs apart from this po that will not make me sleepy? At medyo baliktad ata dito sa kabila. Pagsabayin ko na siguro kasi pwedeng i-combo answer to ni Doc John. Alaga inbox question number 4 from Ma'am Hilda Santos. Nung nag-ECQ ulit, nahirapan na po ako matulog at madalas kabado. Natry ko po yung Sleepasil pero wala po epekto. Ano po pwede kong gawin? Maraming salamat po. Nako, combo question. Isang hirap makatulog at isang, nako, baliktad naman. No, tulog naman ang tulog. So, let's get right to it. Doc John, magkaiba, Doc. Anong advice po natin?
Magkaiba siya, magkaibang end ng spectrum. Yeah, kay Ma'am Angela muna tayo, yung sa quetiapine for bipolar disorder. Thank you for sharing, Ma'am Angela, about your concerns po, no? And the recent diagnosis of bipolar disorder. Again, ang bipolar disorder po ay highly treatable. Talagang meron pong mga treatment available for it and talagang mataas po ang recovery rates. Yun nga lang po, agree ako na meron talagang side effect yung quetiapine. Na it can really make us feel sleepy kasi talagang pinapatulog po tayo to regulate, no, our sleeping pattern. So isa yun in fact sa effects talaga niya, which is, meron siyang good. Meron siyang, in fact, ginagamit yon kasi nga para ma-regain natin ang ating lost hours of sleep. So good, may good effect siya. But yun lang siguro, talk to your doctor about it kung feeling niyo po ay parang nasobrahan naman kayo sa tulog na makaka-impact na siya sa activities nyo paggising sa umaga para mahanap po ng doctor ninyo yung balance, yung right dosage for it. But again, magandang gamot din po yun. Magandang gamot ang quetiapine po. So, wag po siyang tanggalin. Again, before po natin siyang i-adjust, let your doctor know about it kasi meron siyang way of finding that right dosage na balanced for you. Now, kay ma'am naman po, nahirap naman matulog, di ba? Dun sa other end ng spectrum, normal po talaga yun. In fact po, sa panahon ngayon, ang daming nakakaranas noon, Ma'am Hilda, because again of the uncertainty ng panahon, ang dami natin mga naiisip po, nakakakaba, nakakatakot. Again, all of this, pag-isip tayo ng isip sa gabi, kung mga what ifs, anong mangyayari because of the loss of control, wala tayong mga control po sa mga bagay-bagay, then it can really make us feel po na parang kulang sa tulog or hirap matulog. Yung sleep-a-sleep po, that's over the counter, okay lang po yun. But siguro po, kailangan sabayan din natin siya yung tinatanong mo po kung anong pwedeng gawin. Yung mga behaviors po na pwedeng gawin are avoid coffee, lahat po ng mga maiitim na inumin po, coffee, tea, or anything po na dark colored or dark brown na color po, like chocolates, anything po na dark colored sa gabi. Also po, kung pwede po, ang tawag namin dito is sleep hygiene. Walang anything po, walang gadgets. Na-mention na itong gadgets kanina. Kasi yung gadgets po, pag ginagamit natin sa gabi, it emits that blue light. Na itong blue light kasi nagre-resemble siya ng light from sunlight. So akala ng brain natin umaga pa, yun pala gabi na. So part yun ng sleep hygiene, no gadgets po sana sa gabi before matulog, siguro an hour or 2 hours before sleep. Kung ano po, kaya po, i-off ang lights para lesser stimulation at makinig po kung meron kayong music na soothing, calming, so okay din po yun, and shower before going to bed para it psychologically puts us to that yung sleeping na may psychological impact yon pag nagpe-prepare na ang ating katawan for sleep. And again, no dark colored talaga kasi, or exercise also kasi nga yun din nakaka-activate din siya, parang alert pa tayo at energetic pa tayo sa gabi. So ang exercise kung gagawin natin sa umaga po, or basta't wag yung sobrang gabi na or hapon. Yun yung sleep hygiene. Yeah.
Love it. No? So, combo questions na sagot ka agad ni Doc Joan. We're very, very happy. And before we move on to our next question, shout out again sa ating mga viewers, the Mondon family, Noceha family, and we have special shout outs from our partners in Hello Doctor from Ma'am
Hello.
Thank you very much. We're very, very happy to support Hello Doctor here in the Philippines. So, good evening to Ma'am Kai Magsanov and of course the Hello Doctor family. So, talon tayo sa next question, no? And this one is coming from Ma'am Silene Grace. Ang tanong niya, ano po ang cause ng eye floaters? Ay nako, at paano daw po ito magagamit? Yun daw yung mga nakikita nila parang lumilipad-lipad-lipad sa kanilang vision. Anong masasabi natin dito, Doc Mara?
Okay, so yung mga nakikita na floaters, usually, kasi sa loob ng mata natin, no? So meron siyang parang jelly ace. Yung ganun ko na siya kina-compare. So that's what we call the vitreous inside the eye. So yung jelly ace, usually, say with age or if with trauma, for example, para siyang nagli-liquefy. So, yung process na yon na syneresis, ang nangyayari is mas nakikita siya ng eye. So, kahit saan ka tumingin, parang nandun silang lahat, no? So, may floaters pa talaga. So, apparently, some will resolve in time. And others kasi, na kung hindi yun yung cause, yun yung mga kailangang makita ng eye doctor mo to know the underlying reasons kung bakit siya nag-develop ng floater. So, for Ma'am Silene Grace, I suggest that you consult with your eye doctor kahit via telemedicine. So he or she can ask further questions and inquire about your condition to know kung anong nagkakos ng eye floaters po ninyo.
Yan, perfect. Thank you very much for that. At nako, it looks like time flew by once again. Talagang hindi ata enough ang 1 hour. And don't worry, we have a solution to that coming right up, no? But I think it's time for our Alaga Health wrap up. Comes sa Alaga Health Wrap-Up, and it's time for our final words from our invited medical specialist. And don't worry po sa mga nag-comment, huwag kayong mag-alala. Sabi ni Doc Maran, ako, I promise I will answer the questions kahit offline. Kasi may mga pahabol ng tanong sila Ma'am Ellen Villegas, sila Ma'am Emily Damundon. Yan, mga viewers po ng Alaga Health Life, and we're very happy that they continue to watch our program every week. So, si Doc Mara po, sasagutin niya mga questions. Even Doc Joan, possibly. And yung mga nag-send po ng messages sa inbox, we hope to be able to respond to you also. But since it's wrap-up time, probably we can go to Doc Via. Final words or advice regarding eye care, primary care, and of course, seeking consult.
Alright. Again po sa mga viewers namin po, salamat po sa patuloy na pagsuporta sa Alaga Health at sa aming pong programa. Sana po marami kayong natututunan every week po, and patuloy po namin pag-iihin ng aming show po para mas marami po kaming matugunan, no, ng mga concerns para sa kalusugan po natin. At sa mga viewers po na hindi namin pa nasagot yung tanong, we will make sure po that we will be answering your questions via comments and via replies po dun sa inbox namin para at least po may sagot po dun sa mga katanungan po natin. No? Of course po, again, no, we are ending another webisode na marami na naman kaming natututunan from our dear doctors, Doc Joan and Doc Mara, no? One of the things that we would always push for, no, ay wag po tayong mahiyang kumonsulta sa doktor. Ang good news po sa ating mga viewers po, those who are from their homes po or dun sa mga health professionals natin na sa kanilang clinics or sa kanilang workplace, available na po ang Alaga Health app po. So you can sign in or you can register as a doctor or as a patient po. Kahit anuman pong registration, kung saan man po kayo mag-register, it's as easy po as just 1, 2, 3, no? You just register and it will just take you a few minutes for your account to be verified. So for our doctors po who want to be more connected to their patients po, Alaga Health Life is there or Alaga Health is there to attend to your concerns. And for our patients po, especially sa ating mga viewers, nandyan po ang Alaga Health, no, ang aming app, para matulungan po kayong maghanap or kumonekta sa mga doktor po natin. Again po, pangalagaan po natin ng ating kalusugan po. Huwag po tayong mahiyang magtanong sa ating doktor. Nandyan po kami para alagaan kayo. Again, to all our viewers, I'll give a special shout out to my mom and my dad, mama, papa, who's always watching every week. No? Hello po, and to the rest of my family. Thank you very much. Magkita-kita tayo ulit next week, no? And abangan po natin yung spin-off show with Doc Joe, no? Next week, dito po sa Alaga Health Live.
Thank you for that, Doc. Ang maganda, they can watch this Alaga Health Live even within the platform, even within the app. So you can replay your favorite Alaga Health Live episode from the past, especially pag yung topic ay tungkol sa kondisyon nyo. Pwede nyo po siyang panuorin ulit. And you can even rewind it to the parts na very interested kayo. So for example, si Ma'am Suan, na-miss ata ni Ma'am Suan Xiao yung sagot natin kanina sa macular edema, she can watch the earlier part of this very episode na dun po Ma'am, don't worry, nasagot po namin yung inyong question. Don't worry about that. So punta naman tayo ngayon kay Doc Mara. As our off-time training, ano po ang inyong final message to our viewers tonight?
Okay, so our viewers tonight, sana hindi lang tuwing August tayo magiging conscious to have our sight-saving measures, no? Because, eye health is a lifelong and dapat kasama siya sa routine and comprehensive exam whenever we go visit the hospitals or our physicians. So, alam naman natin na the eyes are the windows to our soul. So, it really, really reveals a lot about the body. And sana hindi natin hintayin na pumangit na yung vision bago pa tayo magkonsulta sa ating mga doktor kasi again, prevention will always be better than cure. So at the first symptom or at the first sign na parang alam mo na something is wrong with your vision, it will always be best to visit or to consult your doctor at least to know what's going on and to prevent any further vision loss, no? Kasi alam naman natin kung gaano ka-importante ang ating vision in our daily activities, no? For both work and play and school, everything. So, pangalagaan po natin ang ating kalusugang pangmata.
Yan, thank you very much for that, Doc Mara, no? So I hope you took notes in this particular episode, but since today is very special, before Doc Joan gives us her final thoughts, I'd like to ask our tech team to now load up the teaser for the upcoming spin-off show of Alaga Health Live, the Happy Hour for Mental Health with Doc Joan, Doc Via, and Doc Dex, that will be premiering on Friday this coming week. So this is a major development for us, and we are very excited to share it with you. So with that being said, roll VTR. Yon, that is our teaser trailer for the upcoming Happy Hour for Mental Health spin-off ng Alaga Health. Napansin po kasi namin na every week, parang malagi kaming may napapansin na trend. Puro mental health related questions. So ngayon, we're dedicating our Friday nights all for you to address issues on mental health. And this is gonna be a different kind of show with a different kind of feel. Expect musical guests, some comedy tidbits, and anything to make your day a little bit brighter and happier. Now, of course, meron tayong side consults courtesy of Doc Joan Perez-Rifareal, our celebrity doctor here on Alaga Health Live. So with that being said, now, final words, Doc Joan.
OMG! Dr. Dex, Dr. Via, Alaga Health Team, of course, Dr. Mara, kasama ka na din. Thank you very much for that. Nagulat ako, di ba? Ngayon ko lang napanood yun, but thank you very much again for having me, for welcoming me with the team, with the family. And of course, again, always naman po, lagi kong binibilin or nire-remind lahat na ang mental health po talagang intertwined siya with any physical or social problems po natin or health concerns like ang pag-alaga ng ating eyesight, no, which is really very important. So ako po, just to remind everyone na let's say no to stigma kasi meron po akong mga ibang those under my care po na pag may eyesight problem, nasi-stigmatize po sila. So let us be there to support them, give them our care. Sana po tayo ang magiging second pair of eyes para po doon sa nangangailangan po ng tulong with regards to their eyesight and eye health. And again, thank you very much, and I hope na you will also join us po doon for Happy Hour. Ang ganda ng title, Happy, o diba? Happy lang tayo lahat. Positive and happy. Thank you very much po sa lahat who are present tonight. Thank you po. Thank you.
And there you have it. Thank you very much for that, Doc Joe. No? At ayun na naman po, tapos na naman po ang isang episode ng Alaga Health Live. And tune in next week. Tuloy-tuloy po ang ating episodes here on Alaga Health Live every Saturday. But now, you have another Alaga Health show to watch. For your mental health related concerns, you can watch our Happy Hour for Mental Health every Friday from 8 o'clock to 9 o'clock with Doc Joan. And of course, we continue our celebrations and our championing of different health advocacies every Saturday pa din po, 8 o'clock to 9 o'clock. So with that being said, ito po ang Alaga Health Live and we hope to see you soon next week. Ang bida naman po ay ang ating mga moms at lahat po ng mayroong mga reproductive health concerns at yung mga nagpaplano ng pamilya because we are also celebrating Family Planning Month. So with that being said, we will be having special guests from Popcom, among many others, here on the show once more. So, Muli ako po si Doc Dex Galban na nagpapaalala na alagaan ang kalusugan para mas umunlad ang ating bayan. Muli, ito po ang Alaga Health Live. See you all next week!